welcome to Planetary Health First, Mars Next. I am so excited. We are live here today at VIVE, and I have Dr. Gloria Wu, and man, she is something. She is so impressive. We were just talking backstage, and I guess we can start now because we're on stage. I think her first day in residency experienced 17 gunshot wounds or something. What was that you were telling me?
Well, I did general surgery as my internship, and I am an ophthalmologist. That's kind of rare. But in Elmhurst, New York, which is like a county hospital, my first day, July 1st, 17 gunshot wounds. Every day was like that. It was, how do you say, an eye-opener. Just joking.
Yeah, no pun intended. As an eye surgeon, she is very involved. She's here today at this conference representing helping support lung health. She's also the president of Santa Clara County Medical Association, very involved in AI, moving their acceleration in AI, all things AI in healthcare, which is really important. We've seen a lot of big stuff coming through on that. What else are you really involved in that you're passionate about? You're a solo entrepreneur. You have your own practice. You've done apps. Where do we start on this little conversation today?
Well, I am so happy that I'm here. Thank you very much for being here with you. And I'm not usually interviewed for a podcast at 8 o'clock in the morning, so this is so fun. Starts my day. I really love ophthalmology, and I love retina. And retina is a lot of imaging. All of ophthalmology is imaging. And I kind of have a photographic memory, so it was a great field for me. So during COVID-19, all of us in ophthalmology lost 80% of our patients because nobody wanted to come in. So we saw patients in the parking lot. So then I started doing free apps for them. So I did a free vision app called Telehealth Eye Test, so they could tell me what was their vision over the telephone. And then along the way, I did more apps. And so my current one is really fun, called Eyequix, Eyequix, on iStore and the iPhone. And also it's on Droid, just got on Droid. It fights dementia and vision. Now, my journey, I love ophthalmology, love my patients, so I got involved in how to help my patients, especially prior authorization. I got involved in sort of the political side, talking to my state legislators. I got elected to the AMA, and I represent District 7, which is Santa Clara County for California Medical Association, and it's really an eye-opener. So for all those physicians out there, you can make a difference. Join your state medical society. I became president of Santa Clara County Medical Association, which is a membership of 4,500 doctors, and it's a privilege to serve. I've gotten to talk to a lot of my colleagues, some who have felt burnt out because if you remember COVID-19 March 2020 in California, Gavin Newsom on March 17th, St. Patrick's Day, closed it all down. We were told to stay home. The playgrounds were closed. I couldn't play tennis at my local playground. We had to just stay inside. And the police would patrol. This was hysterical. I felt like, okay, this is a war zone. So I'm sure that's a reset for everybody. I still was on call. I had no facial masks, no plastic gloves. All of us physicians felt terrified. So I had the privilege at South Bay American Medical Women's Association delivering 200,000 free masks to my female doctors who felt equally traumatized and scared. So from that, we came to this new experience, and I decided that, okay, I'm going to get more energy from this. So then I was lucky. I became elected to the Santa Clara County Medical Association, and I realized that during that time of the pandemic, everything was on Zoom, so AI was important. So I made it for this year, my presidency 2024, to make AI in healthcare something important.
I love that. And I tell you, Dr. Will, I don't know when you find sleep, but you are really impressive with all your activity, all your energy, and I'm really excited that I got to know that you play tennis. I'm a tennis player too, so I don't know if you do pickleball too. Do you do pickleball?
A little bit.
Yeah.
It really helps my slice, pickleball.
Yeah, it really is. It's very, the dinking. If you don't know what a dink is unless you know pickleball. But Dr. Wu, this is so awesome to have you in today, and I'm really super glad that I'm hearing a mission right now, focus on AI. You really are big on that opportunity in healthcare, and you want to be driving that. Is that correct?
Well, I think, you know how ChatGPT got 1 million subscribers within a week, and it's huge, we all know that. It's more than that, and I think that we as doctors should take the helm in helping companies deliver the type of message for our patients, and also for doctors, that we just don't want engineers to do this in a vacuum. I'm not saying that they are in a vacuum, because Google, Apple, Meta are very smart companies and they have doctors on board, but we're the rank and file. We're the solo practitioners. We're still 40 to 60% of the market. When grandma goes to see their doctor, it's one of us. Some of us go to Kaiser and the very big groups, and they're great organizations, but still it boils down to the individual doctor. What can we bring to the patient, and how can we make that journey good for them and good for all of America? Because we have to be alive.
Yeah. So what are you looking forward to this year, 2024, with AI? What are you involved in currently?
So now we're in the educational mode. So we're training our doctors to really understand it's more than ChatGPT. There's data analytics, unstructured data, and we in solo practice know that all our patients matter. For example, I'm in San Jose, which is home to 166 languages, many cultures, and we need to have people know that these cultural differences play a role in healthcare. For example, if you're a South Asian male and you have a cholesterol of 200 compared to a white male with a cholesterol of 200, the South Asian male has a 40% higher risk of stroke. So we want all these tech companies to understand the little differences, because now they can, because AI is very powerful.
So how do you see them enlisting you? Where's the important cartilage or that connective tissue to get clinicians involved? How are you facilitating that?
I think we're having 3 educational seminars in our Santa Clara County Medical Association. We had one February 17th with 30 in person, 20 on Zoom, and it was nationwide. We had speakers nationwide coming in on Zoom. Some, came. And we're going to have another one in May and September. So number one, we're going to show Silicon Valley, where we are, that we are a player, that we have 4,500 doctors. We are a resource for them. We have data for them, our patients. We could be de-identified, and we want to move the kind of clock forward so that they can see when they do drug trials, they include our patients, not just everyone standard white male, VA, or something like that.
Well, Dr. Wu, it's been a super awesome pleasure to have you here today live at VIVE on Planetary Health First, Mars Next. Until next time, friends, make it a great day.